Hello students, the topic for presentation which I have prepared, the one which I taught you yesterday while showing the ribs. I have taught you about the ribs and I have shown you the same in PPT, and the same I am recording and sending it to you. So what are ribs? These are elongated, curved, flat bones. So they contribute to the formation of the thoracic cage, particularly the side walls of the thoracic cage. And these are arranged in 12 pairs. And developmentally, they represent a part of the vertebra known as the costal element. Now let us see where from the word the rib is derived. The Latin word coston is the one from which the ribs or costae is derived. The coston includes rib plus costal cartilage, which means rod, and from which the word rib has come. Now, what type of bone it is? It's a long bone. But what is the difference between it and the long bones? If you make a cut section of the long bone, it will be like a rod on cross section. But in the case of the rib, it's not like a rod on cross section. It is flat and it is not rigid like the long bones. And the long bones have a thicker compact layer, but the rib has got thin compact outer layer, and it is highly resilient or strong. Now let us consider the general features of a rib. So what will be the length of a rib? We are seeing the ribs of different sizes, and among the 12 pairs of ribs, 7th rib is the longest rib. And as you progress above in the thoracic cage, it gradually becomes shorter. So the first rib is the shortest rib. And similarly, when you come down in the thoracic cage, starting from the 7th, again it becomes progressively shorter. And so the one with maximum length is the 7th rib. And the maximum transverse diameter is at the level of 8th rib. And the adjacent ribs will be separated by a space which is called the space between the ribs or costae, that is the intercostal space. So the rib is articulating posteriorly with the thoracic vertebrae and anteriorly with the sternum through costal cartilages. In this picture, we can see the sternum. This is the manubrium, this is the body and xiphoid process of sternum. And you can see the articulation of the sternum with the rib. This is the rib articulating with the sternum. And in this picture, you can see the vertebra. This is the body of the vertebra and this is the transverse process of vertebra. The body of vertebra will have two facets, one near the superior border and one near the inferior border on the lateral surface, and which will articulate with the head of the rib, and then the tubercle of the rib will be articulating with the facet on the transverse process of vertebra. In this picture, you can see the articulation between the manubrium and the first rib you are seeing, and in this picture you can see the articulation in relation with the lateral surfaces of the bodies of vertebra that contain the superior articular facet for the rib and then the inferior costal facet, superior and inferior costal facets for the ribs. So this is the vertebral end of the rib, and you are seeing a facet on the transverse process of rib for articulation with the tubercle of the rib you are seeing. Let us see the general features of a rib. We are seeing the rib and seeing the vertebral end and then the sternal end. And then you can identify the two facets in relation with the head, and then this is the neck and the tubercle of it, and you can see the outer surface and inner surface of the shaft of the rib, and the vertebral end will be at a higher level than the sternal end, and the distance between the two will be about 3 to 5 inches, and the ribs and costal cartilages, they increase in length starting from the first to seventh rib, and they increase in obliquity starting from the first to ninth. So the ribs are curving anteriorly and inferiorly. That's why the distance between the two ends is 3 to 5 inches. Then let us look into the classification of ribs. The ribs can be classified by two ways. The first type and second type I am going to tell you in detail. They are classified into true ribs and false ribs. That is one type of classification. And the second type of classification is typical and atypical ribs. So let us consider the first type of classification. So it is classified into true ribs and false ribs. What are true ribs? The first to seventh pair of ribs are true ribs, and they are also called the vertebro-sternal ribs. So these are the true ribs because they attach directly to the sternum by costal cartilages. So posteriorly they are attached to the vertebra, thoracic vertebra, and anteriorly to the sternum through costal cartilages. Then there is the false ribs. So these are from 8th to 12th pair of ribs are called the false ribs because they are attached posteriorly with the vertebra, but anteriorly they are not directly attached to the sternum through costal cartilages, which the first 7 pairs are doing, and they are getting attached indirectly by a common cartilage, and that's why they are called, that is the 8th to 10th pairs, they are attached indirectly by a common cartilage. That's why they are called vertebrochondral ribs. Then the 11th and 12th pairs of ribs, they will not attach to sternum at all. They are not at all attached to the sternum anteriorly, and only attachment is their posterior attachment with the vertebra, and these are called the floating ribs. They are called the floating ribs. And what is that word costal margin? The 7th to 10th conjoined cartilages, they contribute for the costal margin of a rib cage. So we are seeing the costal margin of a rib cage. This is the 7th. Then you can see the 7th, 8th, 9th, 10th. So they are contributing for the costal margin. This is the one. And now you know what are true ribs, which are vertebro-sternal 1 to 7. Then the false ribs, which are again divided into vertebrochondral ribs and floating or vertebral ribs. So 8th to 10th are vertebrochondral ribs. The 11th and 12th are the floating ribs or the vertebral ribs. So true ribs are vertebro-sternal. False ribs are vertebrocostal and vertebral ribs. So now we have understood the classification of the first type into true ribs and then the false ribs, which are again divided into two categories, vertebrocostal and vertebral ribs. So what are these ribs? They are true ribs. So first 7 pairs. Then what are these ribs that are marked? That is the false ribs, which are both vertebrochondral and vertebral ribs. Then what is the second type of classification of ribs? They are classified into typical ribs and atypical ribs. What are these typical ribs? They have typical features. They are called the typical ribs, similar features. They are the 3rd to 9th ribs. You can take any of these ribs from 3rd to 9th and they will have the common features, which is typical for the rib. Then there are atypical ribs. They will have some differences in the features of a typical rib. So that's why they are called atypical ribs. So whichever is not typical is atypical. So what are they? First, second, 10th and 12th ribs are atypical ribs. Now you know the second classification into typical and atypical ribs. There is one more called the supernumerary ribs. So in which region they are located, the ribs? They are in the thoracic region and they are in contact with the thoracic vertebra. So typically all the ribs are thoracic. But if there is a rib in the higher up cervical region or lower down in the lumbar region, they are called the supernumerary ribs. So now you understand what is supernumerary rib. Now you can identify what are typical ribs. So 3rd, 4th, 5th, 6th, 7th, 8th and 9th are typical ribs. Then what are atypical ribs? 1st, 2nd, 10th, 11th and 12th are atypical ribs. Now you understood the classification of ribs. So go through the flow chart. In this, the first method and second method are shown. The first method of classification is they are classified into true ribs and false ribs, which are again classified into vertebrochondral ribs and vertebral or floating ribs. The second method of classification is into typical ribs and atypical ribs. Now you can see the typical rib having the two ends, sternal end and the vertebral end. Then this is the shaft of it. Now you can see the rib. So this is the posterior end, which will be having the head, neck and the tubercle part. And this is the anterior end showing a cup shaped depression for the attachment of costal cartilage. And you are seeing the curved shaft having an external surface and internal surface. Now let us see the typical rib. So which has got the posterior or vertebral end, the anterior or the sternal end which joins with the costal cartilage, and at the posterior end or vertebral end the parts are the head, neck and tubercle. Then you are seeing the sternal end which will be having a depression for the costal cartilage attachment, and you are seeing the shaft, the external surface and internal surface of the shaft, and in this image you are seeing the vertebral end details. There is the head having two facets, the neck and the tubercle part of it you are seeing. So you are seeing the vertebral end which is at a higher level when compared to the sternal or anterior end, and it is having the head, neck and tubercle you can observe in this picture. So you are seeing the vertebral end which is having the head, neck and tubercle, and head showing the two articular facets which are costal demifacets. So they will articulate with the corresponding facets in relation with the thoracic vertebra. So the adjacent thoracic vertebra with which these facets will articulate. And then if you see, there is a crest in between these demifacets which is in contact with the intervertebral disc between the vertebral bodies. And neck is this narrow part between the head and tubercle, and the tubercle, it shows an articular part and a non-articular part. Articular part will have a facet which articulates with the transverse process of vertebra with the same number. So the inferior facet on the head and the facet on the tubercle, they articulate with the numerically corresponding vertebra. That is, the superior facet of the numerically corresponding vertebra is this one, and the transverse facet of the numerically corresponding vertebra, this part on the tubercle. So now you understood the upper small facet at the head is for the vertebra above, the lower large with the numerically corresponding vertebra, and the crest of head with the intervertebral disc to which it is attached by means of intra-articular ligaments. Then the neck is the flat part. Okay. So it will be lying opposite the transverse processes of vertebra, and it is having an external surface and an internal surface, or anterior and posterior surfaces, and it has got a superior and inferior borders. And if you see the tubercle, it's the backward elevation at the junction between the neck and shaft of the rib. It is divided into a medial articular and lateral non-articular part. Articular part will fits into the facet in relation with the transverse process, and it is having a transoval facet. The non-articular part will articulate with the tip of the transverse process by a ligament known as the lateral costo-transverse ligament. Now you can see the head of the rib with the two facets and the ridge between. This is the neck having the anterior and posterior surfaces, superior and inferior borders, and this is the tubercle which will be having a facet for articulation with the facet on the transverse process of vertebra, and these are the two facets in relation with the bodies of the vertebra with which the facet, the superior facet in relation with the head of the rib with the inferior facet on the vertebra above, and then the inferior facet which is larger, and then will articulate with the numerically corresponding vertebra, the superior facet. And you can see the articulation of a rib with the vertebra, body and transverse process. And the shaft of it is flat, thin and curved. So it is extending from the tubercle backwards and laterally, then abruptly forwards. This is the curvature of it. The shaft you are seeing, and at the point where it changes its direction is called the angle of the rib, and this is the weakest part of the rib which can fracture. And the shaft has got two surfaces, the external surface and internal surface. And the inner surface of the shaft is smooth, and it is marked by a ridge. This is the ridge, and below which there is a groove called the costal groove. So this is the costal groove is between the ridge, costal ridge, and the inferior border of the shaft of the rib. This is the superior border. The superior border is thick, whereas the inferior border is thin and sharp. And the superior border has two ribs, an outer rib and an inner rib. Then if you take the sternal end, it is at a lower level than the vertebral end, and it shows a concave facet for attachment with the costal cartilage. Now you can see here. So the anterior end, and then this is the posterior end, showing the head, neck and tubercle and a convex shaft. And then this is the inner surface and this is the outer surface. This is the point where there is change in the direction of the angulation of the shaft, called the angle of the rib. And you are seeing the costal groove, which contains these three structures from above downwards, that is the vein, artery and nerve. So the mnemonic to remember the structures in the costal groove from above downwards is vein, artery and nerve. So now you can see the articulation of a rib anteriorly with the sternum through costal cartilage, and then the posteriorly with the facets in relation with the bodies, and the transverse process of vertebra and the intervertebral disc between the two vertebral bodies you are seeing. This is also the articulation with the vertebra. So the two vertebral bodies and the intervertebral disc and the transverse process. So the inferior facet with the numerically corresponding vertebra. And what is the intercostal space? You can see between the two ribs there is a space, that is the intercostal space, which contains the muscles, and there are contents. The contents which we have studied is the vein, artery and nerve. They are the intercostal vessels and nerve. You can see here. So how they are entering into the costal groove between the layers of muscles. The contents of the intercostal space you are seeing, and how these vessels and nerve will travel also you are seeing in the costal groove. So the costal groove contains the intercostal vessels and nerve of an intercostal space. So they are separated from the floor of the costal groove by a muscle called the internal intercostal muscle. Then there is the sympathetic trunk also will be seen running vertically across the anterior aspects of heads of lower ribs. The internal surfaces of the ribs are covered by the pleura, that is known as the costal pleura.